Let me ask you a quick question. If I told you there's a sign, silent, almost invisible, that appears in your body weeks before a heart attack or stroke, would you know how to recognize it? Most people don't know. And it's not because they don't pay attention. It's because nobody has ever told them. I am Dr. William Carter, a cardiologist with over 28 years of clinical experience. And throughout my career, I have seen perfectly healthy people who went to the doctor regularly, took their medications correctly, die from something that could have been prevented. Not because medicine failed, but because no one taught them what to really look for. And today, I'm going to change that for you. Before we continue, I need to tell you something important. Throughout my years of practice, I have compiled the most effective methods, simple, evidence-based methods, to help my patients manage their blood pressure naturally and consistently. And I organized all of that into a guide called 30-Day Blood Pressure Reset. It's a digital book that you can start using today. And only today, when you purchase the guide, you receive 2 more completely free digital books to complement the method. The link is in the pinned comment and in the description of this video. Now, let's talk about what's really going on with your heart. Do you know why high blood pressure is called the silent killer? Because she doesn't shout. She whispers. I remember one of my patients, I'll call him Robert, to preserve his privacy. Robert was 64 years old. He was an active man, worked in the garden every weekend, walked 3 times a week. In appearance, the epitome of health. He came to my office on a Tuesday morning complaining of slight dizziness. He said he thought he hadn't slept well. That it was probably stress from work. When I measured his blood pressure, it was 178/112. He nearly fell out of his chair in fright. But I don't feel anything, doctor. And that's exactly where the danger lies. High blood pressure, in the vast majority of cases, doesn't hurt. It doesn't warn you. It simply works silently, hardening your arteries, overloading your heart, narrowing the blood vessels in your brain, day after day, week after week. Until the day the silence ends. And when it ends, it's often too late. So what do you need to watch out for? What might your doctors be missing? I'll tell you now. How many times have you woken up with a slight headache in the back of your neck, and thought it was muscle tension? That you needed coffee? That it would go away on its own? This pain, especially in the morning, located at the back of the head, is one of the classic signs of high blood pressure. And it's one of the most ignored. I'm not talking about a severe migraine. I'm talking about that moderate, persistent discomfort that you take a painkiller and forget about. This pattern, waking up with neck pain, feeling it improve throughout the day, deserves medical attention. It's not something to ignore. Another sign that my patients often underestimate is a subtle change in vision. I'm not talking about suddenly going blind. I'm talking about small flashes of light. Slightly blurred vision. The feeling that something is different, but you can't quite put your finger on what it is. When pressure is chronically elevated, the small blood vessels in the retina, your eyes, are under constant pressure. They can narrow. They can leak. And here's something very few people know: an ophthalmologist can see signs of advanced hypertension just by looking at the back of your eye. Before any serious symptoms appear. If your perspective has changed in recent months, don't ignore it. This is the one that worries me the most. Because it's the easiest to rationalize. I'm tired because I'm 65 years old. I'm tired because I don't sleep well. I'm tired because life is hectic. And yes, tiredness is part of natural aging. I know that. But there is a specific type of fatigue that is not normal. It's tiredness that appears without a clear reason. Tiredness that doesn't improve with rest. The feeling that your body is heavy even after a night's sleep. When the heart is working harder than it should to pump blood against high pressure, it becomes exhausted. And you feel it. Even if you don't know that's what it is. Pay attention to your energy level. Not how it was 20 years ago. How it was 6 months ago. Have you ever climbed a flight of stairs that you've always climbed without a problem, and felt more out of breath than usual? Or did you wake up in the middle of the night with a strange feeling of shortness of breath? This isn't necessarily anxiety. It isn't necessarily a lack of physical fitness. It could be your heart sending you a message. When high blood pressure goes untreated for years, the heart muscle begins to change. It grows. It becomes stiffer. And it loses its ability to fill properly with blood between heartbeats. Doctors call this diastolic dysfunction. The result? The blood flows back to the lungs. And you feel short of breath. This is a sign that should never be ignored in someone over 60 years old. I need to be direct here. Because this is a matter of life or death. Any chest pain, any discomfort, pressure, tightness, burning sensation, that lasts more than a few minutes and then goes away, requires immediate medical evaluation. Not, I'll see if it goes away. Not, I'll go to sleep and check tomorrow. Now. Many of my patients describe the pain of a heart attack not as that dramatic scene we see in movies, someone collapsing to the ground clutching their chest. Often it's a mild pressure. A tightness in the center of the chest that radiates to the left arm, to the jaw, to the back. And the worst part? In women over 60, the symptoms of a heart attack are often atypical. Nausea. Extreme fatigue. Back pain. No chest pain. This is why heart attacks in older women are diagnosed much later than in men. If you are a woman watching this video, remember this information. It could save your life. Now I need to talk about something that deeply bothers me as a doctor. Something I see happening with alarming frequency in doctors' offices and hospitals across this country. I'm not here to attack my colleagues. Medicine is a science of uncertainties, and doctors work under enormous pressure. But there are systemic errors, patterns of failure, that disproportionately harm older patients. And you need to know what they are. The first mistake is the most common. And perhaps the most dangerous. Modern medicine has a healthy, and necessary, obsession with metrics. Cholesterol, glycated hemoglobin, blood pressure. Numbers, numbers, numbers. But here's the problem, the reference values for blood pressure that are used to this day were defined based on studies conducted predominantly on middle-aged men. Patients over 70 or 80 years old have a different physiology. In some cases, a slightly higher pressure may be necessary to ensure that blood reaches the brain adequately. I've seen elderly patients suffer serious falls, resulting in hip fractures, long hospital stays, and serious complications, because the medication lowered their blood pressure too much. Too quickly. The right medicine in the wrong dose can also be harmful. If you are over 70 and taking blood pressure medication, talk to your doctor specifically about the recommended target blood pressure for your age and medical condition. Not just the standard number. Here is a frightening reality. Studies show that most people over 65 take 5 or more different medications at the same time. Some take 10, 12. And each new combination of medications opens up the possibility of an interaction that no single doctor can fully predict. A common anti-inflammatory drug, the kind you take for back pain or arthritis, can significantly raise blood pressure. And it can interfere with the effectiveness of your heart medications. Those nasal decongestants you buy without a prescription for that winter cold. Some of them raise blood pressure. They are absolutely contraindicated for people with hypertension. I always tell my patients, never buy a new medicine, even without a prescription, without first asking your doctor or pharmacist if there are any interactions with what you are already taking. This simple question can prevent a hypertensive crisis. Most people are familiar with white coat syndrome. It's when blood pressure rises in the doctor's office due to nervousness. And the doctor prescribes medication for hypertension that doesn't actually exist in everyday life. But there is the opposite problem, and it is much less discussed. Some people have perfectly normal blood pressure in the doctor's office, and elevated blood pressure at home. This is called masked hypertension. And it's dangerous precisely because it doesn't show up in routine clinical measurements. The solution? Home monitoring. Have a blood pressure monitor at home, the kind that measures on the arm, not the wrist, and take regular measurements at different times of the day. Record the measurements. Take the data to the doctor. This simple habit can reveal a life-saving pattern. How many times has a doctor asked you about stress? About sleep? About what's on your mind? Probably few. Because consultations last an average of 17 minutes, and there is a lot to cover. But here's what science unequivocally shows: chronic stress, the kind that doesn't go away, that permanently lingers in the background, raises cortisol and adrenaline levels in the blood. These hormones constrict blood vessels. They increase heart rate. They raise blood pressure. And when this cycle repeats itself for months or years, it causes structural damage to the heart and blood vessels. Financial worries, loneliness, grief, family conflicts, these aren't just emotional problems. They are real cardiovascular risk factors. And they deserve medical attention just as much as cholesterol. In addition to medical errors, there are everyday habits that seem harmless, that are putting your heart at risk right now. I'm going to be honest with you about them. Not to scare you, but because you deserve to know the truth. Most people think that controlling sodium means not putting salt in their food. That's a huge mistake. The salt you put in your pan represents, on average, only 10 to 15% of the sodium you consume. The rest? It comes from processed foods. Industrially produced bread. Cheese. Cured meats. Canned soups. Ready-made sauces. A single deli sandwich can contain more than 1,200 milligrams of sodium. The recommendation for adults with hypertension is less than 1,500 milligrams per total day. You don't have to live without enjoying food. But you do need to read labels. You need to know what you're putting into your body. This one surprises a lot of people. Medicine used to think that if you took your daily walk, you were protected. That exercise compensated for everything. Today we know that's not quite the case. Recent studies show that sitting for extended periods, 4, 5, 6 hours without moving, causes metabolic and cardiovascular changes independent of exercise. In other words, even if you walk for 30 minutes every morning, if you spend the rest of the day sitting on the couch or in a chair, you're still at risk. The solution isn't to exercise more. It's to break the sedentary lifestyle. Get up every 30 or 45 minutes. Take a short walk around the house. Do some stretching. Small breaks throughout the day make a real difference to your cardiovascular health. Poor sleep is not just an inconvenience. It's a heart risk factor. During deep sleep, your blood pressure naturally drops. It's a recovery period for the heart. If you're not reaching this stage of sleep, due to insomnia, untreated sleep apnea, or a fragmented sleep pattern, your heart isn't resting as it should. Obstructive sleep apnea is especially concerning. It affects a huge proportion of people over 60, and most don't know they have it. If you snore loudly, wake up feeling unrest, or experience excessive daytime sleepiness, please talk to your doctor about a sleep study. This could be more important than any medication you are taking. Most people know that sodium raises blood pressure. But few know that potassium and magnesium help lower it. And the average American diet is drastically deficient in both. Potassium, found in abundance in bananas, sweet potatoes, beans, avocados, and leafy greens, helps the kidneys eliminate excess sodium. It balances the pressure on the walls of blood vessels. Magnesium, found in nuts, seeds, whole grains, and dark leafy green vegetables, helps to relax the muscles of blood vessels. I always tell my patients, the best pharmacy starts in the kitchen. Now I want to talk about what really works. No fads. No miracles. Strategies based on decades of clinical evidence, and my personal experience with hundreds of patients. Most people measure their blood pressure incorrectly and receive numbers that don't reflect reality. Here is the correct protocol. Sit quietly for 5 minutes before measuring. Do not drink coffee or exercise in the half hour prior. Place the cuff at heart level. Measure twice, 1 minute apart. Use the average. Do this in the morning, before taking your medication. And at night, before going to sleep. Record everything. Over the course of several weeks, this data will reveal patterns that a single measurement in the doctor's office would never show. Here's something we rarely teach in consultations, but which has solid clinical evidence. Slow, deep breathing, specifically, 6 to 10 breaths per minute, activates the parasympathetic nervous system. This reduces the heart rate, dilates blood vessels, and can lower blood pressure by several points within minutes. I'm not talking about complex meditation. I'm talking about stopping for 5 minutes and breathing. Inhale for 4 seconds. Hold for 2. Exhale for 6. Do this twice a day. In the morning and at night. And tell me if you don't feel a difference after 2 weeks. Moderate aerobic exercise, and I emphasize, moderate, is one of the most effective interventions available for blood pressure. We're not talking about a triathlon. We're talking about 30 minutes of walking at a comfortable pace, 5 days a week. The kind of walk where you can hold a conversation, but feel like you're actually moving. For people over 60, I recommend starting with 15 minutes and gradually increasing the time. The important thing is consistency, not intensity. And one important detail, outdoor walks have an added benefit. Exposure to natural sunlight helps regulate vitamin D, which, in turn, plays a role in controlling blood pressure. 2 dietary patterns have the strongest scientific evidence for controlling blood pressure in people over 60, the DASH diet and the Mediterranean diet. These aren't restrictive diets. They're eating patterns. And they have a lot in common. Both emphasize vegetables, fruits, whole grains, legumes, fish, and olive oil. Both limit red meat, salt, ultra-processed foods, and refined sugar. I don't expect my patients to change everything at once. But if you make just one change today, replacing processed bread with a whole wheat version, adding a serving of fish twice a week, using olive oil instead of butter, you're already moving in the right direction. Small steps. Sustainable. Over time. Let me share 2 stories with you. True stories, from real patients. Names have been changed to protect privacy. Margaret was 67 years old when she first came to see me. She didn't have any clear symptoms. She came because her daughter insisted. When I reviewed her medical history, she was taking anti-inflammatory medication regularly for arthritis. She had a nasal decongestant that she used whenever she had a cold. And she had recently started taking an herbal supplement that a friend had recommended. Each of these factors, individually, was manageable. Together, they were creating a perfect storm. Margaret's blood pressure was consistently high at home. She had bought a monitor at her daughter's suggestion, but normal at the doctor's office. Classic masked hypertension. We adjusted the medication. We replaced the anti-inflammatory with a compatible alternative. We reviewed the supplement. And we started a simple dietary protocol. Within 6 weeks, Margaret's blood pressure was under control. She told me she felt more energetic than she had in years. Harold was 72 years old. He was a quiet, proud man. The kind who doesn't like to bother the doctor with little things. For months, he would wake up feeling slightly dizzy in the morning. Sometimes he would feel a tingling in his left arm that would last a few minutes and then disappear. He attributed it to the pillow. To his circulation. To his age. When he finally came to the office, because his wife wouldn't accept any more excuses, we performed the necessary tests. Harold had suffered several silent mini-strokes. Small cerebrovascular events that didn't cause paralysis or slurred speech, but which had been accumulating damage. He remained silent when I told him. For a long time. Then he said, "Doctor, I thought it would seem excessive to complain about a little dizziness. There's no such thing as exaggeration when it comes to your heart. No symptom is too small to mention." Harold's story changed because we arrived in time. But it was a close call. If you've made it this far, I need to thank you. Not because you watched me, but because you cared enough about your own health to listen to this carefully. And that's no small thing. Most people wait. They wait to have a strong symptom. They wait for something to happen. They wait for someone to say it's urgent. But modern cardiovascular medicine teaches us something very clear: prevention saves more lives than any emergency treatment. What I want you to do now is simple. Pay closer attention to your body. Be aware of the signs we discussed today. Don't downplay what you're feeling. Share this information with your doctor. And please, don't let pride, fear, or the hope that it will pass cost you your life. You've made it to 60, 70, 80 years old. You deserve every year that's still to come. And if you want a practical step-by-step guide, something that complements what your doctor does, within your routine, at your own pace, I've prepared something special for you. The digital book 30-Day Blood Pressure Reset. This brings together the most effective methods I use with my patients for natural and consistent blood pressure control. 30 days. A clear protocol. With small changes that make a real difference. And only today, when you purchase the guide, you also receive 2 additional digital books completely free, to further deepen your cardiovascular care. The link is in the pinned comment and in the description of this video. Take care of yourself. Protect your heart. Because he has been working for you, every single day, without stopping, since before you were born. I'm Dr. William Carter. And until the next video.